Hi. So moving on a little bit from tits and tails to talk of something I know a lot about personally and can probably speak for about 10 hours on a workshop, but I will try to limit myself to the time I have. So a little bit about let's see if I can use this, okay. A little bit about my own experience. When I have my name tag on, I've got multiple ribbons because I have had my own experience as a psychologist, and when I did my training, I became fascinated with the connection between the mind and the body and how stress can affect health and well-being. And I also worked in medical settings, and that was my first exposure to people who had chronic health conditions and pain, and really enjoyed working with everyone in that setting as well. And after I graduated in 2014, right after becoming a mother, it was about a year actually after that, I was diagnosed with mucosal melanoma. So you've heard a few things about mucosal melanoma today. It's a rare form of melanoma. It's fortunately becoming a little bit more heard of, but it's not thought to be related to sun exposure. And it can be more difficult and challenging to treat, and there's lots of questions. But this was about 2016, and really a lot has changed since then. There are less questions. There's still lots of questions. I have a Google alert set up for mucosal melanoma, and there are more hits these days. It's good. Most of those hits are still, these patients were excluded from this trial, but it's becoming more known and more talked about. So I do appreciate MRI and everything they've done for that awareness. And this is a little meta, but I have a photo of myself working on this presentation while waiting for my PET scan a couple weeks ago. So just letting you know, I am still experiencing Scanxiety myself regularly. I've been through over a year of intensive treatments and had CTs, MRIs, PET scans that I still continue to get. My own experience with Scanxiety has changed over time, but it's not gone away. And what I've learned through preparing for this talk is that everyone's experience is so different. And I had many assumptions that most people had the same experiences, but through preparing for this talk and speaking with other patients and warriors and survivors and caregivers, I have learned a lot. So I will share with you just a little taste of what I have discovered, but there's so much more that needs to be done. And if you have trouble with Scanxiety yourself, I have some recommendations, and they may be helpful to others you know as well. So what is Scanxiety? It's a little difficult to put a pinpoint definition on this. If you haven't experienced it, you might not know what it is, but if you have experienced it, you definitely know. Some people describe it as a physical feeling, distress that can occur before, during, and after a scan, a medical scan. There's some attempted definitions here that I've shared with you, but I think the point is that we're still kind of learning about this term. I believe the term was just born out of the community of people that were experiencing scans, and there has actually been some research, which I was surprised to find out. And the things that I'm going to be talking about today are not limited to the anxiety you might feel around medical scans. There's a lot of things that happen throughout medical treatment or staging, diagnosis, that these can apply to as well. So it's not just limited to medical scans. So there was a study recently, actually, by Derry Vick et al. That looked through the literature and reviewed it to find and pool together all these studies that have mentioned Scanxiety. And what they did was try to put into categories to explain the different parts of Scanxiety, because it's a little difficult to understand it and help it if you don't really know how to describe it. I thought they did a really nice job here. So one main category that popped out was anxiety or Scanxiety about the scan results themselves. And another category that came up was scan procedures. So I don't personally experience the bottom category, so I hadn't really thought much about it personally. But when I read through these, it makes sense that you may feel anxiety about the scan itself. So whether there's risk associated with the scan or just being unfamiliar with the process. I mean, really, if I think back, my first MRI, it's a pretty scary experience if you don't know what it is. It's very noisy, you're in a very small space. So some people actually experience anxiety about these things. A lot of people that I've spoken with, and myself personally, after having experienced those things, maybe you've developed some skills for dealing with that. It's more about the results themselves and uncertainty and change that might come as a result of those things. Who and when, again, I pulled out some content from some of these studies, but I think what it's important to really note is that it's not just the person that is undergoing the medical scan that might experience anxiety, it's also caregivers, or really anybody in your life. I think my family members experience it, and they're texting me and, did you get your scan yet? Did you get your results? So I know that they're feeling something too. So just, who can get it? Really anyone who knows someone who's going through some sort of medical scan. And then when, I think it varies for everybody as well. It could be a month before, it could be a week before, it could be that day, it could be during, and it could be after. How does it feel? Again, this is something that will be different for everyone. I don't think it's just fear, a feeling of fear. I think Scanxiety, the term, of course, has anxiety in it, but there's a lot more that goes into it than just anxiety or fear. There may be physical, psychological symptoms, maybe your thoughts, nervousness, maybe your heart rate increases. You may experience any number of these things that are up here, and there are many more too. This is just a short list. Why is this a problem? Well, of course, it's distressing. Whoever has experienced it knows this, but it also can impact other parts of someone's life. So their relationships might suffer, their ability to perform a job, maybe even their ability to take care of themselves. And I think important for the medical providers to understand too is that it could impact their choices in their medical care. Maybe the anxiety is so debilitating that they choose not to do things that maybe are recommended. Or I also feel there could be some overutilizing of medical care when people are feeling nervous and they continue to reach out to your care team and are kind of overutilizing those services. So tips and tools, I like this quote, to make it suck less, because, it's going to be there. Okay, the first, and this is based on a few things. I compiled these three, and I use the research that's out there, of course, but also in talking to some of my fellow warriors, I kind of reshaped a lot of the things I was going to say. I was going to come at you from a very psychology perspective, but I think that the experience of people that are going through this was formative for me. So number one, self-compassion. I think it's very difficult to do anything or thrive or make changes until you hit this first part of it, and that is to accept, acknowledge, and understand that this is normal, it happens, and it may continue to happen. And once you can kind of feel that is the case, then you can maybe move forward. But self-compassion comes at all points. It comes at the point where maybe you feel guilt about feeling so nervous, or maybe you can reward yourself after the fact. But until you actually allow yourself to have compassion for yourself and others, it can be very challenging to improve your experience with Scanxiety and maybe even thrive. Okay, the second is self-reflection. So I think often when we experience it, it's like you almost white knuckle your way through it, and at the end you're like, wow, that was wild, and then you kind of move on with your life. But if you take a moment to self-reflect and actually ask questions about what it's like for you, or what is particularly challenging for you, you may be able to use that information to help inform a plan or a way to improve it for yourself. Maybe you experience the anxiety at a certain time point more than others. Maybe it's really high, the day before. Asking questions about this can be very helpful to coming up with a plan. And finally, self-advocacy. I'm calling this self-advocacy because moving from self-compassion and maybe learning about yourself is actually having to put that foot forward and do something to make a change. And it's advocacy because it's tough to change, especially when you're doing something to improve your own life, your own quality of life. We do a lot to help others, and I'm also talking to you caregivers. If you're experiencing this, is being able to, or allowing yourself to take that step to make a change, to improve it for yourself, can be one of the most challenging things. There has been, like I said, some research, and there's been some research on interventions or things that can be done to help. The results are mixed, and I think much more research is needed, obviously. About half have shown a change. There's been a little bit to show that using more than one thing can be helpful. So maybe using distraction plus some sort of education is better than just doing one thing alone. Also passive. So, studies that showed that someone would just watch a video or do something passively might not actually reduce the Scanxiety. Okay, so what does this look like? I pulled out 4 different parts of the experience, and I think you could consider this to be like the legs of a chair. If you're feeling very uncertain, if you feel out of control, and you're kind of feeling shaky and like you don't have your own, you don't have control in your life, right? So each one of these things represents a leg of a chair where you can feel more grounded, feel more stable, feel more secure, and that is going to help you with those feelings. So you may be very adept at managing the mental side of it. Maybe you're really good at acknowledging when you're feeling nervous or having thoughts that are racing, and you're pretty good at bringing yourself back down. But your body's still a little out of whack. You've got a racing heart or sweating, or you maybe don't sleep. That could be an area where you look at making some changes, and it might help you feel more grounded overall. Existential on here represents spirituality or having some sort of purpose or greater purpose outside of yourself and out of your experience that might help ground you as well. So I pulled out some quotes here. I don't know why that just popped up and went away. So these are some quotes and clips from actual patients that have gone through Scanxiety and caregivers, and I thought they were very rich and helpful in understanding what this is like, maybe beyond the research. And I also wanted to highlight what these things look like in real life. So self-compassion, when you're looking at mind, body, spirit, and all of that, is, again, acknowledging that everyone's different. Your body may react. You may have worried thoughts pop up, and accepting support. This is tough for some people. Sometimes support comes from kind words from others or people offering to take you out to lunch or help around the house, and it can be very difficult to do that. But also keep in mind that these people may also be experiencing their own Scanxiety, and that doing those things can be helpful to them as well. So please take the time to read some of these quotes if you can, just for the sake of time. I won't be reading each of them, but I think it's really helpful to see that some people are starting to notice things about differences. I think if you don't take anything else away, it's that everybody is different, so you really need to look at your own experience to see what is challenging for you. Self-reflection and assessing the situation. So noticing what physical changes you might have, sleeplessness, nervousness. What are the worries about? Do you have specific worries that pop up for you? There were some people here, I love these quotes that were talking about, maybe physically they were getting uptight. Their husband actually was the one who brought it up. They didn't notice it until then. Someone else was told they were irritable, short, and uptight, and not sunny. And they said, I felt wound tighter than a 12-string guitar. I thought that was kind of a beautiful way to say that. And then this other person here is saying that, they're identifying that their fear is that, there's something better they're being called to. So, these people have been looking at these things, looking at what's difficult for them, and really digging into it. And I know that can be challenging, but, you can use that information to come up with a plan. And then self-advocacy. So I think far and away, the number one thing that I was seeing when people were sharing their experiences with me had to do with thoughts. And I had thought of organizing this talk a little differently, but thoughts became such a big part of it that I decided to pull these out here within self-advocacy. So this person says, I believe that if something specific medically is taking up my thoughts, I write it down on my list of questions for the next doctor's visit. So getting the thoughts out and on paper was really helpful to them. I personally, so when I came up with some things that were helpful to me, Superstition actually came up for me. I came to realize that every time my husband was with me in the doctor's visits, the medical scans, the results that I got were negative. So he was not allowed to come to the doctor's appointments with me anymore. My sister came, and ever since then, things were great. So I really, that sort of superstition, and I hold it lightly, but that was helpful to me. It made me feel like I had some sense of control. Some people, like this fourth quote here, they like to have the results on my chart before going to the doctor's office so that they can have time to process, come up with questions, and then be ready to hit the ground running when they spoke to their provider. That is not the case for me. I have learned that I need to be right there in the room with the provider when I get those results, or else my panic is at an all-time high, because there's always something that comes up that might be a question on these scans. Not always, but often. So if I don't have that person there right in front of me, that's when my anxiety gets really high. So knowing yourself and knowing what works for you and what doesn't work for you is very important. I really liked this woman has a YouTube channel called Recovery Room. She gave a really great talk on this, actually. It's one of the few resources out there that I found when I was looking. I'm not going to play this video for you here for sake of time, but she highlighted 3 things. Having a before scan plan, and again, if you're not sure what that might mean for you, you could think about physically, mentally, socially, all those points. Do you want to set up lunch with your friend? Do you want to set up maybe a relaxing massage? Things that will help you before, if you notice that you normally have higher anxiety that starts to peak. Just set up a plan. And again, with that self-compassion, allow yourself to do that and to make changes in your time and your schedule. Then the distraction plan. Distraction can be very helpful. Most people say it's most helpful right before the scan result or right before the actual scan. She suggests taking someone with you in the waiting room, walking the halls, using music and videos. Entertainment of any kind is usually pretty helpful. And then having a post-scan plan. It's very important when you're doing the assessing part of this to actually ask how you will be getting your results, if it will be coming through the chart, if you'll be getting it from your provider, if you'll be getting a phone call, and actually knowing how those will come out. And I know people who have made changes to that. They've discovered that they can get their results differently. They can walk over to a different room and pick up their results early. Just making the plan around the actual obtaining the results and knowing what those are so that you can advocate for a plan that works for you and make changes if you need to. I pulled out some other examples of coping strategies that were shared with me that I just thought were particularly lovely and had a really great self-advocacy spirit to them. And these come directly from, actually, my mucosal melanoma warriors community. Okay, so this is from Eileen. I visualized the movie Fantasia, the scene where Mickey, the apprentice, gets all the mops and brooms, cleaning like crazy. I envision that is my immune system, my immune therapy, cleaning out all the cancer cells. This is a example of visualizing. And this is something that can be done during the scan or in moments of intense anxiety. I think it comes to that feeling of not being in control. Visualizing something actually happening can make you have a little bit of a sense of control. I try and remind myself that worry causes wrinkles and my Botox bill is high enough. For me, the tears come easy. It's about finding the joy and laughter in every day, and especially in the moments that feel absent of joy. Laughter and humor is a big part of coping, and I think this is just a wonderful, both acknowledging and being vulnerable about why she uses humor, and then just using humor in a great way to help her body calm down. And thank you to RS for sharing that. I am a strong proponent of the power of positive thinking, but it's not just an attitude, it's a discipline that requires learning a bit more each day. I love the active way this is phrased and how, yes, you can try to think positively, but there's sometimes a discipline to it where it's a consistent effort and work that is put in. Thank you, Cindy. And from the beginning, I planted this firmly in my faith. With every appointment, treatment, and test, I reminded myself of God's promise and then gave a Bible verse quote here. I love this because it combines a mantra with spirituality. Mantras can be very helpful when you're having a mental repetition of thoughts and just having a grounding thought. And this person's was a Bible verse. So, this, she said, works well for her in all settings. So thank you to her as well. I also think it's important to know when to seek help. So, I think any time is okay to seek help. And by help, I mean counseling, a support group, or any other, like a professional. I think it's never a bad time. I'd say if you particularly notice that Scanxiety is getting in the way of your life, if you're having a hard time coming up with a plan to deal with it, to manage it, if you're making decisions you might not be recommended to do based on maybe getting scans or your medical care. If you're having concerns about the procedure itself that are difficult, like maybe you have a fear of needles or the claustrophobia, something around the scan procedure itself is very problematic or concerning for you, there are people usually within those clinic settings that are identified that can be helpful to you and do things with you to help relieve that anxiety. Let's see, also where most medical centers, especially the large centers, will have easy referrals to people that they know that are set up that can help you with these things. That really, Scanxiety is the number one thing that has come up when I have, my local cancer organization, Gilda's, I gave talks there a couple of times. And the number one thing that they said when I would ask what I could give a talk on, with the intersection of mental health and cancer was Scanxiety. So this is a common thing. This comes up a whole lot, and they usually have people that they can recommend or refer you to through your clinics. There's also resources online like findhelp.org or cancercare.org, and even your medical insurance will usually have a list of providers that are covered in the mental health field or in counseling that can help you. And again, there's no wrong time to do this. If you need any support at all, it's great to have someone else to talk to about this and to help you come up with an individual plan. And other local cancer support organizations can also be very helpful. So, okay, I think I left a little bit of time for questions, although like I said, this is something that I could probably sit here and talk about for a very long time, so this was a very quick overview. And thanks again to the people that provided their experiences with me and were vulnerable, and also to the MRA for always having the patient in mind and thinking about their experiences and offering talks like these. Okay. There's someone in the back.
I'm on the way. Hi, thank you so much.
Hi.
Oh, that was very loud. Sorry. Thank you. Thank you very much for that presentation. That was wonderful. And I think, as a patient myself who has struggled with Scanxiety for a decade or more, like this has been very helpful. And I'll just share with the group one thing I do personally is put a bottle of champagne in the refrigerator before I go for scans. And so I know it's ready for celebration when I get my results because it's going to be good. So, but I think one thing, Dr. Ward, is that and I certainly can't speak for everyone in this room as a patient, but I can speak for myself in saying that my patient experience involved a lot of guilt around how horribly my family and loved ones were feeling. Mm-hmm. And so when you were saying about your family also has Scanxiety, can you recommend to us any tangible real-life tips to help our family members and loved ones get through this Scanxiety, like as we also care for ourselves? But I feel like the caring for ourselves, maybe we have a better handle on. The helping our loved ones come along with us through it, maybe we could use some better direction if you have it.
Oh, sure, thank you. I mean, I think just understanding that they're experiencing this too and that it's different for everyone as well. I know with my family personally, we had to kind of come up with a game plan because they were texting me, like I said, a lot, and it was actually, upsetting to me when I would be getting these texts, and I'm working really hard to distract myself. So I think having a conversation about it can be very helpful to understand exactly what they're needing in that moment. They want information. I knew when I'd get my results, but they didn't. So for my family, it was just having a conversation about what's challenging, and we did come up with a plan where I would let them know that I'd get the result on this day at this time and that I would call them. So just having that understanding of when and what the results are going to be like, and how we can communicate was helpful just for everybody. And then, like I said, sometimes people want to help the person who is going through the medical, issue themselves, and that is helpful to them. So as the patient, I just, recommend that you allow that to happen when you are able to, because that is something that helps other people in your life as well. And I know it can be difficult because it can feel like accepting help that you don't maybe need, but I think communication with your family and also understanding that everyone needs to cope differently. And I will say, one thing I forgot to mention that was shared with me that I think is really important also to pull out and highlight that I wasn't really aware of myself was that for some people, Scanxiety is not as much about the fear of the result. Maybe you have a lot of confidence that the result's not going to be something that's going to change your life. For some people, it is the remembering or it is the prior experiences that have happened that come back. So maybe you are confident mentally and that everything's going to be okay, but your body is reacting, and maybe you don't understand why, but maybe it's because, you've been here before and there's things that have happened, and it's just sort of triggering memories too. So thank you.
So I'd like to thank JB for the fantastic remarks. I know, don't want to offer your time, but I know you're going to be with us for the rest of the evening. So if you have additional questions for JB, please speak with her later. And now I think we're ready for our next panel.